Hi guys, Dr. Rob Barrington here with some more nutrition advice. I'd like to talk today very briefly about a very effective way to lower raised levels of plasma cholesterol. Now, before I give you this very easy nutritional approach, I would like to very briefly discuss plasma cholesterol levels. It's important to understand that plasma cholesterol is not the cause of heart disease. Plasma cholesterol, raised levels of plasma cholesterol, are associated with cardiovascular disease, but that does not mean that it is the cholesterol that is causing the heart disease. What it means is that there is another parameter, possibly the development of the metabolic syndrome, which leads to inflammation, and that inflammation is the cause of heart disease, that also increases plasma levels of certain lipoproteins. And this is because the metabolic syndrome is associated with a dysfunction of the liver, and the liver is the main processing unit of lipoproteins. So as the liver develops a metabolic dysfunction, the levels of lipoproteins in the body change, the levels of lipoproteins in the blood change, but at the same time the metabolic syndrome also causes the heart disease by causing inflammation which damages the artery linings. So although raised levels of plasma cholesterol are associated with cardiovascular disease because they have a common link to the metabolic syndrome, they are not the cause of it. However, when we lower plasma cholesterol levels, what we are actually doing is we're reversing the metabolic dysfunction in the liver. So we're not actually directly affecting cardiovascular disease through the lowering of the cholesterol levels, but those nutritional approaches that we have that do lower cholesterol levels usually reverse the metabolic dysfunction of the liver. So what can you do if you have raised levels of plasma cholesterol? You want to take a nutritional approach. Well, one of the most proven effective solutions to raised levels of plasma cholesterol is to increase your consumption of oatmeal, oats. Oat bran fiber in particular, but also the polyunsaturated fatty acids in oats have been shown to cause a lowering of plasma cholesterol levels. Now, if we take in 3 grams of oat bran fiber, we get roughly a 10 to 20% reduction in levels of plasma cholesterol. Now, because every 1% reduction in plasma cholesterol levels causes a 2% reduction in the risk of cardiovascular disease, if we take in 3 grams of oat bran fiber per day, we get roughly a 30% reduction in the risk of cardiovascular disease. 3 grams of oat bran fiber is roughly 1 bowl of oatmeal. So if you have a bowl of porridge oats, you're taking in roughly 3 grams of oat bran fiber. So therefore, consuming 1 bowl of porridge oats per day will reduce your risk of getting cardiovascular disease by around 30%. That's a big drop. You'd be hard pushed to beat that with any pharmaceutical drug. And that's just one nutrient, that's just one addition to the diet that will cause that improvement. There are other things that you can take nutritionally that will lower cholesterol levels. There are many nutrients that do lower cholesterol. Garlic is another very potent lower of cholesterol levels. The vitamin B3, niacin, can also lower cholesterol levels. Legumes, beans will also lower cholesterol levels. And there are many, many other substances nutritionally that you can take that will cause a lowering of cholesterol levels. Now, it has to be stressed that if your cholesterol levels are normal, and what is normal, because no one knows what normal cholesterol levels are, there is a range that is called the normal range. If you're within that normal range, taking oats will not lower your cholesterol levels more. They will simply lower your cholesterol levels if they're already raised. So this is the benefits of the nutritional approach. They normalize cholesterol levels. There are no side effects to consuming oats. You will get other health benefits from the oats as well, because oats will also improve your blood sugar. Now, it's interesting to speculate that the way that oats are actually beneficial to the cholesterol levels is through their blood sugar lowering effects. Raised levels of blood sugar are known to be one of the contributory factors to metabolic dysfunction in the liver, and we know that that metabolic dysfunction in the liver is what causes raised levels of lipoproteins and also leads to heart disease. So it may be that oats, by their blood sugar modulating effects, are actually able to modulate lipoprotein levels as well. So therefore, what I would recommend is that if you are currently consuming typical Western diet, or your diet is not particularly healthy and that you've been shown that you have high cholesterol levels, I would certainly consider consuming a bowl of porridge oats per day to help lower your cholesterol levels. If you want to go further, I would suggest that you investigate some of the traditional diets, particularly the Mediterranean diet. And if you can completely abandon your Western lifestyle and your Western type diet and consume a more traditional type diet, such as the Mediterranean diet, you should be able to quite easily normalize your plasma lipoproteins and your cholesterol levels.